Hello everyone, welcome to Eye Care Beyond the Eye Clinic series on the Eyelid with your favorite eye doctor, Dr. Khan. It's good to have you back. Today we are going to be having a general overview of the eyelid with a very special guest in our midst today, and she's an eye care professional with expertise in primary vision care, diagnosis, treatment and management of vision changes. She is no other person than Dr. Sandra Igbinadolor of Adetula Optical Services, Ikeja, Lagos. Alright, she's going to give us a general overview. We appreciate you so much, Dr. Sandra, for taking our time to be with us today. Please do not forget to like, do not forget to share this video with friends, with family, with relatives, and do not forget to follow the page if you're yet to do so. Alright, at the end of this series, there's going to be a question based on what was taught today, and you're supposed to answer the question for you to partake in the Eye Care Challenge and get a chance to become the Eye Care Genius Ambassador for the month of September. If you do not know what I'm talking about, there is a video, just search for the video down that talks about, I think the heading is Eye Care Challenge. You get an idea of what it entails to become the Eye Care Genius Ambassador for the month of September. Okay, so I'm going to see you at the end of the video, but for now, do not forget to like, do not forget to share, and do not forget to follow the series. Let's make welcome Dr. Sandra Igbinadolor. Thank
you. Hello. Good morning, my name is Dr. Sandra, an optometrist at Adetula Optical Services, Ikeja, here in Lagos. So today I'll be talking about the eyelid. The eyelid is actually one of the external structures of the eyes and is a thin fold of skin that actually covers the eyes and protects it. Okay, we have the upper eyelid and the lower eyelid. The eyelid features a row of eyelashes, so we have the upper eyelashes and the lower eyelashes. We further protect the eye from dust, foreign body and sweat. So we have various functions of the eyelid, and we're going to highlight just two of them. One of them will be it helps and it protects the eyes by spreading tears around the front surface of the eyes, so as a result of blinking. So when you blink, the two eyelids are closed and it helps to spread tears around the front surface of the eye. Now the tears we're talking about is not the emotional tears that we see regularly. No, that's not the tears we're actually talking about. So another function of the eyelid too is it protects the eyes from getting dried while you're asleep. So while you're asleep, the two eyelids are closed together, and so it protects the eyes from getting dry, because once the eye gets dried, it gives a lot of discomfort. So we'll be talking about conditions that can actually affect the eyelids. Okay, any condition that affects the eyelid is known as eyelid disorders. So there are various eyelid disorders, but we're going to talk about maybe 4 of them that we'll see every day, or that's really common. So number 1 would be style. Style is actually an infection of the eyelid, and it is caused by a bacteria. It appears as though there is a red bump on the eyelid, and it's very painful. It can cause redness of the eyelid. It can also cause the eyelid to be swollen. Now if you see or experience any of these symptoms, I'd advise you go to an optometrist, visit an optometrist. They'll carry out further tests, and whatever prescription that comes out, you'd likely go to the pharmacy and get the various medications prescribed by the optometrist. Now do not for any reason self-medicate. Always go to an eye clinic to get your eyes checked. Now there are other home remedies that we can use. I guess that is why this is called the eye care beyond the hospital setting. Now there are some things that we can actually do for ourselves at home. You can apply warm compress to the eye. It helps to relieve you of the symptom, that's the pain, the redness, and it aids healing. It makes the healing faster even with your medication. And also maintain good and proper hygiene. Ensure you wash your bedding, your bed linens, ensure you wash your towel, whatever it is you can apply on your face or you use for your, ensure it's always kept clean. Okay, another condition that can actually affect the eyelid is chalazion. Now, chalazion occurs when there is an obstruction of the oil gland of the eyelid. Now, it can actually affect the upper eyelid or the lower eyelid, and it actually looks like star. The only difference between it is that chalazion is less painful compared to style, is less painful, and like I said before, visit an optometrist, and then you perform your home remedies too, your home therapies, that's your warm compress, like I said before, and maintaining of good and proper hygiene. Now, another condition is called blepharitis. Blepharitis is the inflammation and irritation of the eyelid, and it is actually caused by a bacteria, and also dandruff from your scalp can actually fall on it and fall on the eyelids, and it can actually cause an infection. Now, there are some symptoms of blepharitis, which are burning sensation, the feeling as though there's something in the eye, and light sensitivity, redness, the eyelid becomes swollen, and like I said before, visit your optometrist, ensure you carry out these home remedies, use your warm compress a lot, and proper hygiene. Okay, one last disorder of the eyelid I would love to talk about is blepharospasm. Blepharospasm is called eyelid twitching. This is the involuntary spasm of the muscles of the eyelid. Now, this is when you notice your eyelids are twitching. It's like a door is moving. You can see it, it's visible when you look at it. You see that though the eyelid is actually moving. It's called blepharospasm, and it's due to certain factors like fatigue, stress, and the use of caffeine. Try as much as possible to rest, which is also a home remedy. Try as much as possible to sleep for at least 6 hours every day, and try as much as possible to reduce your intake of caffeine. That would go a long way. To reduce the blepharospasm, that's the twitching of the eyelid. Thank you very much for listening. I deeply appreciate. Thank you so much. Okay, I really want to say a very big thank you to Dr. Khan for having me on Eye Care Beyond the Eye Clinic. Thank you very much for this opportunity.
Wow, thank you so much, Dr. Sandra. It was an amazing session. Really appreciate you. I hope we all learned something. As usual, we are still going to break down this eyelid. She talked about the structure. She talked about partly some conditions that could affect, and somehow how to care for the eye. She also managed to touch that in such a short time. We really appreciate you. We're going to break down these things, and we're going to have practical sessions. We're going to do a live practical on how you can actually do some of these things she talked about, like the warm compress, and then sometimes you could also go for cold compress, and there are other ways, even massage of the eyelid. There are ways to do it. We're going to do a practical session as we go on. We're going to break it down. All right, so if you have questions, just be patient, and then maybe along the line, as we address some of these things section by section, you'll be able to get a better view of what we're trying to communicate. All right, now the question is going to come right after this video. Please drop your answers in the comment section below. Really appreciate you so much for your time, for your patience. Please do not forget to share this video, because there are lots of things that people need to know, and when you share, they have the opportunity to partake in this series. Thank you so much. Giving a shout out to all our friends and followers in this page. We love you. We'll see you next week with a section on the structure of the eyelid. That's what we'll be starting from, the structure. We'll try to break it down to the minimal level for everyone to understand. All right, and we're going to be building on the things that Dr. Sandra has already exposed us to. Thank you so much, everyone. Do have a lovely weekend. Bye. When we get to heaven, join me next week for another educational and enlightening series on Eye Care Beyond the Eye.